All right, so what we're gonna do is we're gonna go put you through a few movements just to see how your back's working on you here, okay? So if with any of these movements or any of these tests that I ask you to do, if you know there's gonna be any extreme pain or discomfort doing them, don't do the test. I just want to see what you're generally capable of, okay? So the first thing I'm gonna do is I'm gonna have you stand up for me, please. And I want you to bend forward and try to touch your toes the best you can. Any pain or discomfort with that movement? Or just tightness in the legs?
Just tightness in the legs.
Okay, I'm going to have you stand up, please. I want you to extend back as far as you can. Any pain or discomfort doing that?
No.
Okay, just come down sideways. Anything there?
No. No.
Back to center. Twist all the way to the side. And the other way. Those are all okay?
Yes.
Have a seat for me, please. I'm going to have you fold your arms like this for me, please. I'm going to twist you away from me. From there, lean back towards me. Any pain or discomfort with that movement?
And a little right back here.
In through here?
Yeah.
Just on the right side?
Yeah.
Nothing on the left?
No.
Okay, I want you to fold your arms again. You can do the same thing the opposite direction. Lean back towards me. Anything there?
No.
Good. Okay, next up, I'm going to have you lie on your back, please, with your feet hanging off the edge of the table.
Okay.
All right, let me know if there's any pain or discomfort in your back when I do this, okay?
Okay.
Anything there?
No.
Okay. I'm going to have you bend the knee. I'm going to drop it down this way. Any pain or discomfort in your back doing that?
No.
What do you feel?
Hip. Well, not hip. Groin. Right side.
Okay, just like a stretch?
Yeah.
Okay.
Yeah.
And then same thing on the opposite side here.
Okay.
So, straight.
Oh, okay.
Anything there?
No.
Bend the knee. Anything there?
Yeah, lower it back a little bit.
Where?
Here.
Right in the middle?
Yeah.
Off to the side?
Off to the side.
Okay. So the left side, low back a
Yeah.
little bit when we did that test there.
Yeah.
Okay. All right, the next thing we're going to do is we're going to do a general postural evaluation, okay? I'm going to demonstrate what I want you to do, and then I'm going to have you do it,
Okay.
all right? So the first thing I'm going to have you do is I'm going to have you stand in front of the mirror. I want you to get as straight as you possibly can, and once you're there, I want you to close your eyes. And with your eyes closed, I'm going to ask you to march in place for about 10 seconds or so. If you have some balance issues, I'll be there to hold on to the shoulders, okay? But once you're done marching, keeping your eyes closed, I want you to twist as far as you can to one side, as far as you can to the other side, and then back to center. But I want you to keep your eyes closed the entire time as you do that, okay?
Okay.
All right.
My reminders along.
Yeah, no problem. Okay, so get nice and straight in front of the mirror here.
Okay.
Eyes closed. I'm going to have you march in place for me, okay? Okay, stop marching. Keep your eyes closed. Twist all the way to one side, all the way to the other side, and back to center, but keep your eyes closed the whole time, okay? I want you to not move a muscle, but open your eyes. All right? So you started over here. You ended up over here with, and if I'm to mirror you, you're twisted a little bit this way, your shoulders up a little bit like this. Your hips are actually twisted the opposite direction compared to where your shoulders are, and you march forward and off to the side. So what that test is looking for is where your body feels straight up and down. Now when your eyes are open, you can cheat and make sure you're lined up to your surroundings, okay? But when your eyes are closed, you're going by, you can turn around here. When your eyes are closed, you can go by, or you have to go by feel, all right? And there's two main systems that control that. Number one's your inner ear. That tells you where your head's positioned.
Okay.
It also tells you if you're marching straight or if you're drifting off to the side or anything like that. But then you also have some reflexes that come from your back muscles and your back joints. Those are the ones that tell you if you're slouched or if you're sideways or if you're twisted, okay? And those reflex systems are controlled and coordinated through the lower brainstem. So when there's normal function here, the body will return to here being straight up and down. When there's any type of dysfunction, in your case, your body was telling you that this is straight up and down, all right? So this is what we're seeing with gravity in the picture. I want to see what types of imbalances we can find when we take gravity out of the picture. So we're going to get you on the table and have you laying on your back and see if there's any imbalances that we can see there, all right?
Okay.
All right, so we saw some imbalances with you standing in front of the mirror. I want to see what imbalances are there with you lying on your back here, okay? Okay, have you ever broken a leg before?
No.
All right, the reason I asked that question is because your right leg is pulling up shorter than your left leg right now. It's pulling up about half an inch shorter.
Okay.
Has anyone ever told you that before?
No.
Okay, so the reason I ask that is, or the reason we ask that question is, sometimes when we see the leg being shorter on one side than the other, it's not that the leg itself is actually longer or shorter, it's that there's some type of twisting in the muscles of the low back or the hips,
Oh, okay.
So sometimes if you've broken one of the long bones in your leg, it might have healed a little bit funny and left the leg longer or shorter, but in the absence of a major trauma or a break, it's usually the twisting. Now, we saw some twisting with you standing in front of the mirror. I want to see if that same twisting is here right now,
Okay.
So I want you to stay there. I'm going to feel your low back muscles and see if they're contributing to what we're seeing down here.
Okay.
Alright, can you feel all the muscles on this side are tighter than the ones on this side? Okay, well these muscles that I'm feeling are your postural muscles.
Okay.
They should only be working if you're sitting up tall or standing tall.
Okay.
You are doing neither of those things right now.
Right.
You're lying on your back. Those muscles should be totally relaxed.
Okay.
This is what a totally relaxed muscle feels like.
Right.
And we're not feeling that at all down here.
No.
So what's happening is on this side the muscles are better. They're closer to relax. You've got this extra muscle spasm on this side, and what that's doing is it's twisting your hips up and it's pulling the leg short.
Okay.
Now, those muscles are your postural muscles. They're controlled reflexively. So if they're overactive when they should be relaxed, that means there's a problem with the reflex system. So I'm going to do a few more tests to see if there's any other imbalances that we're finding, okay? Because we've seen some in the mirror and we're seeing some with you lying on your back here as well, okay? All right, so the next thing we're going to do is we're going to do a very basic muscle strength test, okay? I'm going to have you look straight up at the ceiling. Are you left or right-handed?
Right-handed.
Any shoulder issues, rotator cuff issues, anything like that? Okay, I'm going to take your left arm, please. I want you to make a nice tight fist. I'm going to push down towards your feet. I want you to not let me, okay? So I'm going to apply pressure. Eventually, you're going to be pushing that way as hard as you can, okay? So just match me. Hold. Give me everything you got. Good. Do the same thing on this side, okay? Hold. Okay. You're right-handed, you said?
Yes.
Okay, do that one more time. Okay. Notice your right arm was a little shakier than your left?
Right.
Okay, I want you to do me a favor. I want you to turn your head all the way to the left for me, okay?
Okay.
Same test. Hold. One more time. Hold. Okay. Turn your head all the way to the right for me.
Okay.
And same test. Hold. One more time. Hold. Okay. Turn your head all the way back to the left for me. And hold. Good. Notice the difference as we change your head there.
Right.
Okay, relax this arm down. Okay, keep your head turned to the left, okay? Okay, turn your head all the way to the right one more time.
Okay.
And back to the left. Okay, I want to feel your low back muscles with your head in that position. Alright, can you feel these muscles are a little bit softer and a little bit more relaxed than they were the first time I felt them?
Right.
Go ahead and turn your head all the way the other way. And things tighten up again more on this side. Okay, bring your head back to center. I'm going to let you know what's going on here, okay? So what we've been looking for have been imbalances. The first imbalance that we found was you looking in the mirror. Your body ended up not being straight. It was a little confused into where it thought straight up and down was.
Right.
Next imbalance we saw was with you lying on your back. We took gravity out of the picture, but we saw the same trends. You had the one leg here that was a little bit shorter, the muscles on this side were a little bit tighter, and even though you're right-handed, your right arm was a little bit shakier than your left.
Right.
But as soon as we started moving your head and neck around, we were able to change some things. We turned your head to the left and everything improved. The arm got stronger, the muscles started to relax in the low back, and your legs were actually balanced and even. That discrepancy wasn't there anymore. When you turned your head the other way, everything got a whole lot worse. That arm became almost useless, the muscles got a lot tighter in through here, and the legs got even more imbalanced. So what your body is showing us is that there's an imbalance, or there's a misalignment in your neck that's affecting how your body's functioning. So right now the bones are misaligned in a certain way. We turn your head to the left, that misalignment improves, and your body starts functioning better, head to toe. We turn your head the other way, that misalignment gets worse. So the exam's showing us not only that there's a misalignment, but also that it's correctable. Because if we're able to see this magnitude of change just by turning your head to the one side, well, if we do a specific correction to that upper neck area, we'll be able to improve things even more, okay? And also it's showing us that part of what's going on with your back is directly being caused by what's happening in your neck. Because as we change your head and neck positioning, we're able to directly change your back's functioning. So I'm going to have you sit up, I'm going to feel some of what's going on through your neck and then what's going on through your back, and then we'll send you next door and we'll get some x-rays taken, all right?
Okay.
So I'm going to have you sit up for me, please.
Just right here.
Yep. Okay, I'm going to have you relax your head forward just a little bit. Good. All right, you feel that right there?
Mm-hmm.
You feel this on the left side?
Not as much as the right side.
And that's my point. This is what it should feel like over on the left. This inflammation here on the right side, you will only feel this when this top bone of the neck has actually shifted out of place to some degree.
Okay.
And that's actually something that goes away immediately when we get that corrected.
Okay.
I feel some of the rest of your neck here. A little tenderness there as well.
Yes.
And there.
Mm-hmm.
So far your right side's scoring about a 0.
Yeah.
Anything on the left or just the right so far?
Just the right so far.
Okay. Anything in through the shoulders here?
Just a little soreness.
Equally on both sides, worse on one side than the other?
Probably worse on right there on the
Okay.
right side.
Yeah, the muscles are a little bit more tight on the right side.
Yeah.
But tightness and soreness aren't necessarily the same thing. The muscle can be overactive without it necessarily hurting more. What we're looking for is any type of imbalance. Because if you're sitting perfectly straight, there's no reason for the muscles on one side to be much tighter than the muscles on the other side.
Oh, okay.
And that's independent of feeling more sore on one side or less sore on the other side. Things are still doing okay in through here?
Yes.
Okay. Now, as we get lower, since you're sitting up, there should be some muscle tone in through this low back, but it shouldn't be imbalanced. It shouldn't be greater on the one side than on the other side. And that will only happen when there's some type of structural problems here with these postural muscles here, okay? So this area right in through here, this inflammation on the right side here. All right, so that swelling and inflammation that you were feeling up at the base of your neck there, that extra tenderness on the right side, what that was kind of this area in through here. So this is the back of your head, here are the bones of your neck. That swelling and inflammation we're feeling right in through this area, all right? Now this is underneath a good amount of muscle and skin and stuff. You shouldn't be able to feel that. The only time you can is when this top bone of the neck is shifted out of place to some degree, okay? Now, when we twist our head from one way or the other way, most of that rotation happens between these two bones. So when you have a misalignment here, that's why we're able to see such dramatic changes in your body just by looking one way or looking the other way. Okay? Now the significance of this area is what's underneath this bone. So the brain's up through here, the spinal cord's in through here, and this transitional area is the lower brainstem. And that controls all the automatic and unconscious things that the body does. Heart rate, breathing, digestion, your hormones, but most importantly, your postural muscles and your postural reflexes. So the exam showed us that your postural reflexes have been impaired in a couple different ways. We saw that in the mirror with your body thinking this was straight up and down. We saw the same trend with you lying on your back with the leg pulling up short and these twisted muscles in through here. So your body showed us in a couple different ways that we definitely have an issue going on in through here. What it hasn't showed us is where the bones are. And that's where x-rays come in. So what we do in this office is a 3-dimensional digital x-ray series. We're going to take 1 or 2 pictures from the front, we're going to take one from the side, and we're going to take one from the top down. And we'll actually measure down to the 100th of a degree to see exactly what's going on in that area, to see how the bone's gone side to side, how it's twisted, how it's gone forwards and backwards. So when you come back in for your next appointment, we'll sit down with you, we'll be able to show you your x-rays and show you your misalignments. We'll be able to show you how long they've been there by the amount of damage or degeneration that we see or don't see. We'll talk about getting you corrected, and most importantly, we'll let you know what you can do to stay corrected so that your body isn't thinking this is straight up and down. So it's knowing that this is where normal is, and you take those abnormal forces off the low back, your body starts functioning better, okay? I know I've given you a whole lot of information over the last 30 minutes or so, but do you have any questions for me?
No, I think I'm good.
All right, well, let's bring you next door and get some x-rays taken.
Thanks.